Hello, hello. My name is Jones, and today we are going to look at psychiatry emergencies. So, in looking at psychiatry emergencies, we are going to look at the skills that one needs to have to nurse a patient with a psychiatry emergency. So, we have the A, B, C, D, and RS as some of the skills that one needs to nurse someone in a psychiatry emergency. Okay, so A is for airway, B is for breathing, C is for circulation, D is for detoxification. If you are doing a first aid, D is for dispose of the patient or repair patient through an ambulance to the hospital. R is for restraining. Restraining is of different types. There's chemical restraint, physical restraint. Then there's also seclusion. Seclusion is like isolation in mental health. Okay, isolation is done in medicine, but in mental health, seclusion is like isolating the patient who is a danger to self and others. Okay, so the skills of mental health that you're going to learn will be summarized in a mnemonic brackets. That is behavior modification, restraining, assertive skills, counseling, observation skills, therapeutic intervention skills, social skills. Okay, so that is black codes. So these are the skills that one needs to have. Then Dr. Scab or Dr. Scab is a mnemonic for the ABCDRS, that is the elements or the dimensions that you need to look at when nursing someone with a psychiatry emergency. Okay, so away from this, we can also appreciate the types of conditions that you are going to nurse in psychiatry emergency. So we have SAD, so that is a mnemonic for suicide attempt as a psychiatry emergency. A is for aggression as a psychiatry emergency. Then A is also for alcohol intoxication as a psychiatry emergency. Then D is for depression as a psychiatry emergency, drug poisoning as psychiatry emergency, and drug abuse and substance abuse, respectively, as a psychiatry emergencies. So the skills are the ones that we have discussed. That is the BRACOTS, standing in for behavior modification skills, restraining skills. So restraint, okay, is therapy that is needed to help immobilize a patient who is uncooperative and poses danger to self or others. So this patient needs to be immobilized. Okay, then we have assertive skills. Assertive skills are needed to help patients solve problems, okay, that they may be facing and have good self-awareness. Then we have counseling skills. Then we have communication skills. So C is for two therapies or skills that one needs to have as they are nursing a patient with mental illness. Then O is observation skills, T is for therapeutic intervention skills, S is for social skills, S is also for social awareness. Okay, so now what is the general objective of this lesson? Okay, the general objective of this lesson is that the student should be able to describe and manage psychiatry emergencies. The specific objective is that you have to identify and manage patients with psychiatry emergencies such as the ones that we have mentioned, which is in the mnemonic SAT: suicide attempt, aggressive patient, depressed patient, alcohol intoxication, drug poisoning, drug and substance abuse. Okay, so just a little bit to understand what suicide attempt is. So suicide attempt is a failed suicide action or action that may that action that may be taken to take one's life, but for one to take their own life, but the, that person ends up surviving or survives from that attempt. So that is suicide attempt. Okay, so in short, it's a non-fatal suicide act or an act that results in one surviving, the actor. Sui, self-side killing. Okay, so appreciate also that there are different types of suicide. Okay, fatalistic, anomic, altruistic, and egoistic, which you can remember through the mnemonic FAAE. Okay, then aggressive patients. Okay, so for aggressive patients, what I can say is that aggression arises from an innate drive or occurs as a defense mechanism and is manifested either by constructive or destructive actions. Okay, so these might be either to self or others. Aggressive people ignore the rights of other people. They fight for their own interests and do not consider other people's interests or rights. Aggression may lead to physical or verbal violence. The aggressive behavior that one will show to be because they are lacking self-confidence. So what they want necessarily to do is show this aggression to enhance their self-esteem and overpower others, thereby proving their superiority. Okay, so they try to cover up their insecurities and vulnerabilities by acting aggressively. By definition, aggression can now be defined as behaviors that is intended to cause harm or pain. Okay, so it can either be physical or verbal. Characteristics of aggressive behavior. Aggressive behavior is communicated verbally or non verbally. Aggressive people may invade the personal space of others or the intimate or private space of others. They may speak loudly and with greater emphasis. They usually maintain eye contact over a prolonged period of time so that the other person experiences some kind of intrusion. So they have an intrusive stare. So the overall impression is one of power and the dominance. One wants to dominate. So when they look at you, they want you to look away. So aggressive clients may also be emphatic in the way they communicate, and in a way, they might also show a lot of gestures that are a little bit threatening, like pointing a fist at the person that they are talking to, or pointing a finger at the person that they are talking to. You know, they may stamp their feet. Okay, so this will be some of the signs that you'll be able to see that may indicate aggression. Okay, the other thing to note in aggression is that posture is erect, and often aggressive people lean forwards slightly towards the other person. Okay, so here you can imagine a person that wants to fight. Okay, so now let us look at types of aggression. The types of aggression that we have instrumental aggression, we have hostile aggression, we have relational aggression. So you can remember these types of aggression using the mnemonic IRH, like integrated reproductive health. So instrumental aggression, it's aggression that is aimed at obtaining an object, privilege, or space with no deliberate intent to harm another person. Then hostile aggression, it's aggression that is intended to harm another person, such as hitting, kicking, or threatening to beat up someone. Okay, then there's relational aggression. This is a form of hostile aggression that does damage to another peer relation, as in social exclusion or rumor mongering. Okay, Moya came up with an influential classification of 7 different forms of aggression. Okay, that range from biological to evolutionary point of view. Okay, so you can remember the types of aggressions that are there using PIF-PAM, okay, as a mnemonic. That is, it will include also what was propounded or what was proposed by Moya. Okay, so P in PIF-PAM is for predatory, I is for intermel, I is for instrumental aggression, I is for irritable aggression. Okay, then T is for territorial aggression, H is for hostile aggression, F is for fear-induced aggression, A is for accidental aggression. Okay, and A is for accidental, F for fear-induced, then R is for relational aggression, and M is maternal aggression. Please take note that also paternal aggression is also one of those types of aggression that is there. So the P for predatory, P for paternal can still be used within this mnemonic. Now, according to Moyer's classification, we have predatory aggression, which is an attack by a predator on a prey. So that aggression which a predator shows when they're about to attack a prey, when they're about to attack a prey, that is predatory aggression. Then intermale aggression, okay, this is the competition between males of the same species over access to resources such as females, dominance, or status. Then there's fear-induced aggression. This is aggression that is associated with attempts to flee from a threat. Okay, then there's irritable aggression, aggression that is induced by frustration and directed against unavailable targets. Then territorial aggression is a defense of a fixed area against intruders. Then there's maternal aggression, which is a female's aggression to protect her offspring from a threat. Then the seventh, as proposed by Moya, is instrumental aggression. Okay, this is aggression that is directed towards obtaining some goal, considered to be a learned response to a situation. Okay, so the other psychiatric emergence that is there is depression. By definition, depression is a state of low mood and aversion to activity that can affect a person's thoughts, behavior, feelings, and a sense of well being. Depressed people feel sad, anxious, empty, hopeless, worried, worthless, and even restless. So, when a person is depressed, they may stop eating, okay, being prone to hypoglycemia. Okay, so that is some of the things that they can show. Then, apart from depression, we also have some different causes that we can talk about to do with depression. So, we can talk of life events. Okay, so a lot of changes in life may precipitate depression. Things like childbirth, menopause, financial difficulties, okay, lack of employment, loss of a loved one, natural disasters such as earthquakes, hurricanes, and tornadoes, relationship troubles, okay, bereavement or divorce, and also catastrophic injuries. Okay, there are also other factors that may cause depression to do with the medical treatment. So this may include someone on hepatitis C therapy, okay, someone on treatment for high blood pressure and they are using beta blockers, and simply when someone is on Rezapine. So to having they are predisposed to having depression. Then the other predisposition to depression is has to do with non-psychiatry illnesses. So infectious diseases, neurological conditions, and physiological problems like hypoandrogenism in men may predispose one to depression. It also all other chronic conditions, okay, like stroke, diabetes, cancer, okay, may predispose one to depression. Then to do with psychiatric syndromes, there are a number of psychiatric syndromes that feature depressed mood as a main symptom. So these include major depressive disorder, okay, common called major depression or clinical depression. Bipolar disorder and personality disorders predisposes one to psychiatry, predisposes one to depression. Okay, so now this takes us to another condition among psychiatry emergencies, which is alcohol intoxication. So alcohol intoxication can come as a psychiatry emergency. So some few terms that we need to look out for when we're talking about alcohol intoxication. When we use the word intoxication to do with the alcohol, we are saying drunkenness or inebriation. Okay, so intoxication is a physiological state that is induced by the consumption of alcohol. Okay, the cause and effects of intoxication is that alcohol intoxication is a consequence of alcohol entering the bloodstream further than it can be metabolized by the liver. Common effects are euphoria, lowered social inhibitions. Okay, and other effects are unpleasant or dangerous because alcohol affects many different areas of the body at once and may cause progressive long-term harm when consumed in excess. Common symptoms of alcohol intoxication. So there are a lot of common symptoms that we can talk about to do with the alcohol intoxication. Some of them include slurred speech, euphoria, impaired balance, loss of muscle coordination in medical term and the medical term for this is ataxia, flushed face, dehydration, vomiting, okay, reddened eyes, reduced inhibition, and we also see erratic behavior. If one takes sufficiently high levels of alcohol, it may cause coma or death. This will be because of the depressive effect that alcohol has on the central nervous system. Okay, so let us also appreciate the stages of alcohol intoxication. So there are 7 stages that we can appreciate in alcohol intoxication. You can remember them with a mnemonic sex code. Okay, so S is for sobriety or subclinical. Okay, E is for euphoria. Then four, that is the other E is for excitement, and then S is for stupor. Okay, C please is for confusion, S for stupor, then CO is for coma, and then D is death. Sobriety or subclinical, the blood alcohol content can range from 0.01 to 0.05. The client's behavior here may be near sober or near normal. The amount of beer that could have been drunk in sobriety could be just 1 pint or 1 bottle of beer. Then the second stage is euphoria. Blood alcohol content in euphoria will be raised to from 0.03 or it will range from 0.03 to 0.12. The amount of beer that could have been consumed could be 1 to 4 pints or 1 to 4 bottles. Of course, take into consideration that it also goes with how one has become tolerant to beer and also the liver function. Okay, in terms of behavior, the person has difficulties in concentrating, they become talkative, there's lowered inhibition, okay, and fine motor skills are going to be lacking within the euphoria stage. Then excitement. Blood alcohol content is 0.09 to 0.25. In terms of behavior, senses are dulled. Okay, there's poor coordination. The client looks drowsy. Okay, with beginning of erratic behavior. There's slow reaction time and impaired judgment. And that is the reason why they say do not drink and drive. Of course, in addition to alcohol, because of slow reaction time and impaired judgment. Then there is confusion. Blood alcohol content in confusion state can range from 0.18 to 0.30. In confusion, the behavior that we see is that there is exaggerated emotions, the difficulties in walking, blurred vision, blurred speech, and pain is down. There's increased threshold to pain, meaning someone will not easily feel pain when they injure themselves because they have taken too much alcohol. Hence, alcohol acting as some kind of mild painkiller or some kind of painkiller at this stage. Then stage 5 is stupor. Stupor blood alcohol content may range from 0.25 to 0.40. Here, in terms of behavior characteristics, here we are saying the person who is drunk to the stupor level or stage cannot stand or walk. They may start vomiting. Okay, unconsciousness in stupor is quite possible. Okay, there is decreased response to stimuli and the patient becomes apathetic. Okay, so stupor, they are slipping into unconsciousness. Okay, if they slip into unconsciousness, it will result into coma. So stage 6 is coma, and this may be due to blood alcohol content of 0.35 to 0.45. Okay, in terms of behavior or clinical observation here, and the patient is unconscious, there's low body temperature. Okay, there's possible death which may result due to reduced due to respiratory arrest or depressed respiratory center. The seventh stage is death. Okay, death may come from alcohol if one has consumed 0.45 and above. That is to do with blood alcohol content. So death comes as a result of respiratory arrest since alcohol depresses the respiratory center. Let us now appreciate the pathophysiology of alcohol intoxication. So in terms of pathophysiology, we are looking at the breakdown of alcohol. Okay, the enzymes that are involved in the breakdown of alcohol up to the time the body or the muscles are able to use the alcohol content. So, alcohol is metabolized in the liver by an enzyme called alcohol dehydrogenase. So the rate of metabolism is faster in a normal liver than in a diseased liver. So taking, for example, ethanol as an alcohol, it will be metabolized by alcohol dehydrogenase and be converted to acetaldehyde, okay, which is found in many tissues, including gastric mucosa, the alcohol dehydrogenase enzyme. We're saying it is found in many tissues, including the gastric mucosa. So this is the alcohol dehydrogenase enzyme that breaks down ethanol to acetaldehyde. Then acetaldehyde is then metabolized or it's further broken down to acetate. Okay, this will come because of the action of acetaldehyde dehydrogenase enzyme, which is predominantly found in the mitochondria of the liver. So alcohol is chiefly metabolized in the liver. So up to this point, we have mentioned these two enzymes that are breaking down alcohol. So from ethanol to acetaldehyde, okay, then acetaldehyde to acetate. Okay, so now in acetate form, it will the alcohol content or byproduct will be able to be used by the muscles to produce acetylcholine. So using the enzyme acetylcholine synthetase, and the acetylcholine is then used in citric acid cycle. Okay, so as earlier noted, we have said It takes roughly 90 minutes for a healthy liver to metabolize a single ounce, or it takes about 60 minutes to break down a single ounce of alcohol. How then can you diagnose alcohol intoxication? So, diagnosis of alcohol intoxication will be based on blood test for blood alcohol content, also called blood alcohol concentration or blood ethanol concentration or blood alcohol level. How then do we manage? How then can we manage alcohol intoxication? Acute alcohol intoxication is a medical emergency due to the risk of death from respiratory depression or inhalation of vomitus if emesis occurs while the patient is unconscious and unresponsive. Emergency treatment strives to stabilize the patient and maintain a patient's airway and relation and respiration while waiting for alcohol to be metabolized. So, as you are waiting for alcohol to be metabolized and you are stabilized, and as you are stabilizing the respiration, you can take care of the ABCs of emergency care for such a patient. For severe respiratory depression, consider an endotracheal tube to protect the airway and assist with breathing. You can protect the airway from aspirating stomach contents that could cause aspiration pneumonia. Okay, the patient with alcohol intoxication is at risk of hypoglycemia. So you are going to give 50 ml or 50% dextrose solution and also do a saline flush. Okay, as ethanol-induced hypoglycemia is unresponsive to glucagon. Okay, so this takes us to another type of psychiatric emergency, which is drug poisoning. Poisoning can result from an overdose of either prescribed drugs or drugs that are bought over the counter. It can also be caused by drug abuse or drug interaction. While waiting for help to arrive, you can look for containers that might help you to identify the type of drug that one might have taken and resulted into poisoning. Okay, so this is quite helpful to help clinician give the necessary antidote. And when one has suffered from drug poisoning, mostly the container, suspected container, which they might have used to take, is found within their vicinity, if possible, if even within their hands. So, in your nursing management, maintain breathing and circulation, help the patient to be in a comfortable position. When they are still conscious, it's the best time to find out what they took, and then you can reassure the patient that everything is being done to detoxify them from that poison that they might have taken. Okay, so you can monitor the vitals of the patient to see the level of physiological damage that the poison is causing. Um, so, the time the patient becomes unconscious, please, you can administer oxygen. Okay, in drug poisoning, you do not induce vomiting to avoid aspiration pneumonia, okay, as chemicals may be aspirated within the lungs, and this may lead to chemical pneumonia or aspiration pneumonia. Okay, let us now look at prevention and control of drug poisoning or drug abuse. So, how can you prevent drug poisoning? You have to reduce access to drugs. Okay, you have to reduce inappropriate prescription. Prescribe only for the condition that one is suffering from. So if you give more drugs, patient will tend to take all of the drugs, and then this may result into poisoning. You need to develop education materials specifically for chronic patients that are suffering from pain, cancer, and the likes, so that they understand, okay, the side effects and the undesired effect that the drugs that they are taking might have if they take in overdose. Okay, to do with substance abuse prevention, here what we can say is provide targeted education to youth. Okay, on evidence-based research on interventions, treatment, and the recovery that is there for people that might be abusing drugs. So abusers are more prone to having drug poisoning than non-abusers. Okay, so and teach them also on how to manage overdose, okay, so that you reduce harm as the patient comes to the hospital. Okay, so now the other item that we can look at to do with psychiatric emergencies, or the last condition that we can look at, is drug and substance abuse. Okay, for the purpose of this discussion, we are describing a drug as a chemical substance which, when taken, changes the functioning of the body and the mind. And then drug use, we are looking at it as using a drug for its intended purpose. For instance, if you are suffering from malaria, you take tablets to treat malaria. If you have some pain, you take paracetamol to treat that pain. So now, when we say substance or drug abuse, we are looking at the intense desire to use increasing amount of a particular substance or substances to the exclusion of other activities. Simply put, substance abuse is improper use of drugs. For instance, taking Piriton to sleep instead of using it to treat allergies. Sniffing glue instead of using it as an adhesive is also a form of substance abuse. Categories of drugs that are abused include illicit or illegal drugs, and then licit or legal drugs. Okay, so illicit or illegal drugs can include heroin, cocaine, and other drugs that are there. Licit drugs, tobacco, alcohol can be some of those drugs that can be abused. Okay, looking at my geographical area, the common abused drugs include alcohol, cigarette, okay, cocaine, and heroin. And also, there's also abuse, or if I may term it, misuse of prescription drugs. Okay, so this takes us to causes and effects of drug abuse. So the causes and effects includes peer influence, low self-esteem, media influence, rebellion against parents, curiosity, and lack of knowledge of drugs. So some people may find themselves abusing drugs because of peer influence. Others have found themselves abusing drugs because of low self-esteem, hoping that it will improve their self-esteem. Media influence. Media plays a huge role, okay, in shaping the behavior of our youths and the behavior of people out there. Rebellion. Okay, so when because they are the causes is others, they will take it just so that they become rebellious against their parents or teachers. Others simply just lack knowledge or they are curious. If you have poor role models, okay, that abuse drugs, you are likely to start abusing drugs. Frustrations may cause one to start abusing drugs. Inability to achieve goals, okay, if you have set goals and then you feel like you're a failure, you may start taking, for example, alcohol in abnormal levels, and that now will be looked at as abuse. Okay, so other causes of predisposition is false ideas and perceptions that people have about taking these drugs. That when you take certain drug, it will enhance your academic performance. Then, when one takes, then they start suffering from the negative effects of drug or substance abuse. So, some of the effects of drug and substance abuse include poor memory and not necessarily enhancing academic performance. Some of the other effect is reduced reasoning capacity. There is truance or poor performance in school, sports, and other activities. And this is from this is based on research that has been conducted that among drug abusers, truance increases. Okay, there is also poor concentration and dropout of school by drug abusers. Suspension and expulsion from school will result or is seen mostly among drug abusers. Okay, so all this is informed by a lot of research, social research that has been done. Okay, other research also shows that drug abusers are likely to engage in risky sexual behaviors that may lead to early pregnancy and HIV/AIDS. Okay, so apart from that, drug abusers are likely to engage in crime like theft, violence, rape, and incest. Okay, so when one is abusing drugs, they are likely to start developing poor health. Okay, they are also likely to have personal neglect. They're likely to have withdrawal and isolation from society. Society tends to shun those people that abuse drugs. So it will lead them living kind of a life of isolation. So people who abuse drug have some kind of personal guilt and also have poor relations with parents, teachers, and their peers. Okay, so when one has been abusing drug, it may lead to physical and psychological addiction, and also overdose of the drugs will result in the unfortunate state of death. Okay, so now let us look at some warning signs of commonly abused drugs. We are going to look at them in terms of groups. So we have stimulants and we have depressants. So stimulants here includes amphetamines, cocaine, crystal meth as some of the examples of stimulants. So the warning signs of stimulant abuse is dilated pupils, hyperactivity, folia, irritability, anxiety, excessive talking, which is followed by depression or excessive sleeping at odd times. Okay, so eating pattern is also affected, leading to weight loss. And then there are warning signs for commonly abused drugs to do with the depressants. Examples of depressant are Xanax and Valium. Okay, here the clinical picture you see is contracted pupils, drunken-like state, difficulties in concentrating, person becomes a bit clumsy, there's poor judgment, slurred speech, and this person is going to have sleep disturbances. Okay, so other group of commonly abused drugs and their warning signs, here we have heroin. So when one is abusing heroin, the warning signs can be contracted pupils, no response of the pupils to light, needle marks, okay, where they have been injecting themselves with the heroin, okay, sleeping at unusual times, sweating, vomiting, coughing, sniffing, or twitching. Then the warning sign for those that abuse inhalants, okay, inhalants like glues, aerosols, or vapors, they will have the following warning signs: watery eyes, impaired vision, memory and memory and thought cognitive process starts going down. Okay, they may have headaches, nausea, and also they have this appearance of intoxication. Okay, they look drowsy with poor muscle control, and also their appetite is affected. What could be the warning signs for people who are abusing marijuana? Marijuana, marijuana abuse. Okay, warning signs include red eyes, loud talking, inappropriate laughter that is followed by sleepiness and loss of interest. There are others also group of drugs to do with hallucinogens. If they are abused, one is going to have dilated pupils, bizarre and irrational behavior, including paranoia. Okay, they may show aggression and may also show hallucinations. Hallucinations are of different types. To remember them, you can use the goat demonic, goat like in the animal goat. So that is GOATV, like goat TV, goat TV. So we have gustatory hallucination, okay, we have genosomatic hallucination, we have olfactory hallucination, we have hostile hallucination, auditory hallucination, tactile hallucination, and visual hallucination. So hallucinations affect the gates of knowledge. The gates of knowledge that is to do with the eyes, visual hallucination, to do with the nose, olfactory hallucination. To do with the ears, auditory hallucination. To do with the mouth, we have gustatory hallucination. To do with a sense of touch, okay, as a gate of knowledge, we have tactile hallucination. Then we also have somatic, genosomatic hallucination. Okay, so now let us now look at preventive strategies to substance abuse. So, to prevent substance abuse, people need to have hobbies, okay, that will take their mind away from more engaging in drug abuse. Okay, an idle mind is the devil's workshop. Okay, so one needs to develop a good reading culture, okay, as a hobby so that it takes their mind away from more abusing these drugs. Okay, the other thing that we need is application of critical thinking, asking yourself, why am I doing this? Okay, what am I going to benefit from this? Okay, so what are the consequences of these actions that I'm doing? So that is going to help one, okay, avoid going into abusing drugs. Okay, developing mechanism for dealing with difficult issues or problem solving will also help one avoid substance abuse. There are sometimes because one has failed to do something, so they resort to abusing a certain substance that they might have been using. So we teach them problem solving skills. So problem solving skill is one of the skills that a mental health nurse should have. Okay, so you can apply it in depression, you can apply it in someone who's experiencing a crisis. Okay, so to avoid peer pressure, you have to choose your friends wisely. You have to develop your personal potential, such as creativity, so that you can handle the challenges that come your way. Appreciate yourself, love yourself, because no one is going to love you more than you love yourself. Okay, so once you do that, you'll be able to identify and pursue your purpose in life. Okay, have some good self awareness by identifying your capabilities, strengths, limitations, weaknesses, and appreciate your strength on whatever you can manage to do. You have to be aware of your physical, mental, and emotional changes that are taking place during your adolescence and learn to cope with them. Okay, so this sums up our lesson, okay, where we are looking at psychiatry emergencies. So we have talked of psychiatry emergencies to do with the mnemonic SAD, okay? Mnemonic SAD, mnemonic SAD summarizes the mental health emergencies. Then Black Coat summarizes the skills, the therapies that can be applied in mental health. Of course, there are also other therapies like marine therapy, okay, or that is modification of patient environment. We have gestalt therapy that can be applied when you're nursing a patient with mental illness. Okay, so it is important that you know that ABC, DRS, or Dr. Scab applies when you are nursing a person with a psychiatric emergencies. So in your resuscitation, you need to give us details. You need to check the airway. You need to check breathing. You need to check circulation, because any malfunction or problem within this may result in the patient dying. Then in psychiatry, emergency drugs here we are looking at detoxification, restraining, and seclusion. Okay, so from me, I'm saying thank you for listening and keep studying.